Did you know that over 34 million Americans are living with diabetes, yet many people don't understand the key differences between type 1 and type 2? Today, we're diving into the facts, the stats, and the latest research to clear up the confusion. Stay tuned, because this information could change how you think about diabetes. First, let's talk about type 1 diabetes. Type 1 is an autoimmune condition where the body's immune system attacks and destroys insulin-producing beta cells in the pancreas. This means the body can't produce insulin, a hormone necessary for getting glucose from the bloodstream into cells for energy. Think of insulin as a key that unlocks cells to allow sugar in. Without this key, sugar builds up in the bloodstream, leading to high blood sugar levels. Type 1 diabetes is typically diagnosed in children and young adults, though it can occur at any age. Now, let's look at type 2 diabetes. Unlike type 1, type 2 is primarily a metabolic disorder. The body becomes resistant to insulin, meaning the cells don't respond to it as effectively. Over time, the pancreas can't produce enough insulin to maintain normal blood glucose levels. Type 2 diabetes is much more common, accounting for about 90–95% of all diabetes cases. It's often associated with older age, obesity, physical inactivity, and genetic factors. Let's break down some key differences with the latest statistics and research findings. Prevalence. Type 1 diabetes affects approximately 1.6 million Americans, whereas type 2 affects over 30 million. Onset. Type 1 usually appears suddenly, often in childhood or adolescence. Type 2 develops gradually and is more common in adults over 45, although it's increasingly seen in younger populations due to rising obesity rates. Causes. Type 1 is autoimmune and has no known prevention. Type 2 is influenced by lifestyle factors, including diet, exercise, and body weight. Treatment approaches also differ significantly. For type 1 diabetes, insulin therapy is essential for survival. Patients typically need multiple daily injections or an insulin pump. Monitoring blood glucose levels regularly is crucial. For type 2 diabetes, treatment often begins with lifestyle changes, such as diet and exercise. Oral medications or non-insulin injectables are common. If these measures aren't enough, insulin therapy may also be required. Recent research has shed light on new treatments and prevention strategies. For type 1, advancements in immunotherapy aim to preserve insulin-producing cells. For type 2, studies highlight the role of bariatric surgery and new classes of medications, like SGLT2 inhibitors and GLP-1 receptor agonists, in improving blood sugar control and even inducing remission. Understanding the differences between type 1 and type 2 diabetes is crucial for effective management and treatment. If you found this video helpful, please give it a thumbs up and subscribe to Diabetes Professor for more educational content. Got questions or topics you'd like us to cover? Drop them in the comments below. Thanks for watching, and remember, knowledge is power in managing diabetes.